Today, we're going to take a mostly qualitative look at a business that checks just about every box you would want a company to invest in for the long term. That company is McKesson MCK. They have businesses in the pharmaceutical and medical supply distribution industry. However, they also have a significant healthcare infrastructure business as well. In 2023, the federal government spent $832 billion on Medicare. Spending on retail drugs seems to only be higher every year, and McKesson is a direct beneficiary of that. Whether or not the stock is a buy will be covered in a separate video after going over things like the balance sheet, growth rate of earnings and revenue, and things like that. But we will touch briefly on margins and revenue here to give you a sense of the scale that they have. So why should you care about this company? Simply put, their footprint is everywhere, from the EHR to the equipment in the hospital to the pharmacy and logistics around the hospital and even consulting. So to give you an idea of the scale of this company, McKesson achieved $308 billion during the fiscal year of 2024. That is $50 billion more than the revenue of Microsoft and about 10 times the revenue of McDonald's. The chances are you probably haven't even heard of them. Hopefully after this you can appreciate the massive scale that they've achieved and the benefits that come with it. So the overwhelming majority of McKesson's business is in pharmaceuticals, where they are distributors for just about every drug you can think of, as well as for medical supplies to just about everyone. I'm not kidding when I say this. When their Q1 2025 results, which is basically the most recent Q2 2024, came in with $71.7 billion in sales in their pharmaceutical segment alone. So let me read that again. For just one quarter, they had $71.7 billion in sales. So they control this part of the market along with Cardinal Health and Cencora, which is formerly AmerisourceBergen. Cencora did $67.2 billion in pharmaceuticals this past quarter, and Cardinal Health did $55.62 billion in sales. So let's just round that up and call it $200 billion in revenue between those three companies in pharmaceuticals. So this business also has a direct link to the growth of the GLP-1 market, and no matter who wins here, McKesson wins by default as the distributor, which will benefit them as part of being the supply chain of GLP-1s. So in this quarter, revenues from GLP-1 medications alone were $8.8 billion, an increase of $1.8 billion, or 26% compared to the prior year. On a sequential basis, revenues for GLP-1 medications increased $1.3 billion, or 17%, as supply constraints moderated. So the U.S. Oncology Network also falls underneath the pharmaceutical segment. So McKesson owns the U.S. Oncology Network, which is a wholly owned subsidiary of McKesson. So the U.S. Oncology Network is basically a network of independent community-based oncologists that are not owned by McKesson. However, McKesson provides support services as well as administrative services to those practices. So they help to work and maintain patient care decisions within the physician's community. However, they also have a big network for consulting. So essentially, the U.S. Oncology Network is a cooperative model where independent oncologists, they come together and leverage resources and expertise at McKesson while maintaining autonomy in their practice. This also includes Epic and Nexus Health. The number of physicians in the network exceed 2,600. In addition to practice management, they also support access to clinical trials. With a research network, that brings together more than 1,300 physicians that are actively enrolling patients into clinical trials of more than 250 locations in 24 states. So McKesson also has three other divisions in addition to their pharmaceutical division: RxTS, which has $1.24 billion in revenue, which is their highest margin segment at 18% profit margins; MedSurg, which is $2.6 billion in revenue, that's 7.6% profit margin; and International. McKesson has a big presence in Europe and Canada with $3.7 billion in revenues and 2.67% in margins. Okay, we're going to go over some of the more interesting components of RxTS, because covering everything would simply take too much time. So RxTS stands for Prescription Technology Solutions. It's a division of McKesson that focuses on improving medication access, affordability, and adherence for patients. So this software allows pharmacies to manage prescriptions, inventory, and patient data along with analytics for prescription trends. Guess who you're going to be using as the distributor for these medications and supplies. So they even have their own EHR as well, and we're going to go over a few of the divisions. Adherence solutions. So this helps patients take their medications as prescribed, as well as to process claims and determine eligibility and coverage. Dispensing support services. This assists pharmacies in efficiently filling prescriptions through robots that count packages and label medications. They also partner with pharmaceutical manufacturers and health plans like insurers to help manage medication costs, along with provider networks to enhance care coordination, like signing up for clinical trials in cancer patients. So essentially RxTS is a technology-driven arm of McKesson that works to optimize the medication supply chain and improve patient outcomes. So the next division we have is McKesson Med-Surg, or Medical Surgical. This is a division of McKesson that specializes in providing, you would guess it, medical and surgical supplies, equipment, and services to healthcare facilities, including clinics, surgery centers, nursing homes, and home health care agencies. So you can see they're basically everywhere in anything that has to do with care. So medical supplies includes anything from gloves and masks to specialized items like surgical drapes, wound care products like dressings, bandages, antiseptics, as well as test kit reagents and the test kits themselves. Surgical supplies includes anything that you would use in an operating room: needles, syringes, sutures, tools. Equipment includes medical devices and equipment from various departments like patient monitoring systems, infusion pumps, diagnostic tools. The distribution network obviously is there. Supply chain management. They also offer solutions to optimize inventory management and reduce costs for healthcare providers. Because again, who you're going to once you run out of inventory, you're going to go right to them. So essentially, McKesson Med-Surg is a one-stop shop for healthcare facilities, giving them the necessary products and services to deliver patient care effectively. Admittedly, this segment is struggling a little bit since the recent revenue surge pull forward from COVID-19 testing kits and reagents. So the comparisons relative to 2021, 2022 are significantly tougher for these last few years, but that's going to change, obviously. So for the next year, this segment may lag, but it's still a great business nonetheless. And again, just their name and presence is just everywhere. International. McKesson owns, partners, and franchises pharmacies internationally, and they deliver meds and supplies as well as IT solutions. So overhangs on the company. So there is significant litigation that they're still facing, although most of it is settled. They have to pay about $7 billion from opioid litigation. In this brief overview, you can kind of already see why McKesson may make a compelling investment. They're essentially a part of every pharmaceutical inpatient and outpatient supply chain across the entirety of the U.S. Along with Cencora and Cardinal Health, they have a stranglehold on this field and it's basically an oligopoly. The razor-thin margins are on 1% on their main business. Their massive scale more than makes up for it, as well as their brand power. Other areas of the businesses have significantly more profit margin to compensate, and you get upside to any innovations in pharmaceuticals like GLP-1s and anything else that there is to come.